Hello, this is Congresswoman Joyce Beatty, and I want to welcome you to my second district-wide telephone town hall meeting for the 3rd Congressional District of Ohio. And I want to thank you so much for taking time out of your busy schedule to join us tonight to discuss the federal issues facing you and your family. Before we get started, I want to share some information that will assist you while you're on the call. We will have ample time for questions during our Q&A segment. If you have a question, I would like you to press 0 and you will be assisted. You will hear me say this throughout my opening remarks. Also, please be aware that the call is being recorded. We will post the recording on our website for individuals who were not able to participate in the call this evening, but want to hear the content of the call. So remember, if you have a question, press 0. After the call, we will be sending out a survey via email to learn more about how I can serve you better in Congress. I hope you will participate because it's important for me to know your opinions. I have an office in Washington that's located at 417 Cannon Office Building, and the phone number there is 202 area code 225-4324. Again, 202-225-4324. My district office is located at 471 East Broad Street in downtown Columbus, and the phone number there is 614 area code 220-0003. Again, 614-220-0003. And tonight, we are live here in the district holding the second tele-town hall. Earlier today, I had the opportunity to have dialogue with district elected officials. We had officials here from the mayor at Whitehall and the mayor of Westerville. We also had 3 city council members. We also had elected officials, city council, folks from Grove City, looking at the diversity of the city and the 29 municipalities that we represent in the 3rd Congressional District. I am also pleased to acknowledge that we have several constituents who are here with me tonight in the office to participate in the Teletown Hall in person. These constituents represent a wide range of community organizations here in the district, and I am glad they are able to join me tonight. I'm pleased that we have the Ohio State University. We have a couple students. We have the Hispanic Chamber of Commerce, and we also have Jack and Benny's Restaurant here. We have the Union Grove Baptist Church. We have our faith-based leaders. We also have Bethel AME Church representatives. And I'm also pleased to say we have a new Tim Hortons in the 3rd Congressional District, and Tim Hortons is here tonight. We also have several women from the Coalition of 100 Black Women. I'm proud to say that I'm an honorary member of the Coalition of 100 Black Women. We also have Stonewall Democrats here, and we also have a representative from our Somalian community. I am so very pleased. I think we also have a little one in the audience with us tonight. So we are excited that we are well represented tonight here in the district. Again, remember to press 0 if you would like to ask a question. Joining us on the call is my expert for tonight. Kathleen Falk is the Regional Director from the Department of Health and Human Services, and she will be available to help us with your questions about the Affordable Care Act and the enrollment process, which is currently going on. We'll be hearing from Kathleen shortly, but I'd like to start the Teletown with an update of the congressional activities in the 3rd Congressional District. But don't forget, if you would like to ask a question, press 0 to be assisted. Some of you may know that this is our second district-wide teletown hall meeting. In early September, I hosted my first district-wide teletown hall in which hundreds of constituents called to ask questions that basically centered around the Affordable Care Act, Syria, and veterans benefits, and a few other things. In early 2014, I will be hosting an in-person State of the 3rd Congressional District meeting. So be looking for that date, I guess I should say coming soon, which we will announce in the near future. We are very excited about that. One of my main goals in hosting district-wide teletown events is to be able to bring Washington to the district. I want to provide an avenue for my constituents to be able to ask questions. In fact, one of the callers during my last teletown hall noticed that we discussed by saying bringing Washington to Columbus. He pointed out that we really actually are bringing Washington to the entire district. So I am so proud that we represent all 29 of the municipalities that make up the 3rd Congressional District. So I want to say thank you to Charles. That's how he identified himself, Charles from Gahanna, for that very helpful suggestion. So Charles, tonight, we hope you're listening because we are very excited about not only bringing Washington to the district, but also taking the district to Washington. Also in July, I had the opportunity to host a Rise Up for Justice voting right teletown hall in which leading voices on voting rights participated and discussed the implications of the Supreme Court's decision in Shelby County versus Holder. We were joined by several attorneys on the call. We had John P. Gilligan of Ice Miller. We had Marcia Johnson Blanco of the Lawyers Committee for Civil Rights. We had Myrna Perez of the Brennan Center for Justice at New York University School of Law, Kimberly Ross, attorney at law, my chief of staff and chief counsel, and Otto Beatty Jr. of Otto Beatty Jr. and Associates LPA. Many thanks to all of them who participated in that civil rights teletown hall and your great ideas and insights on how we can work together on this in Congress. Now let me just give you a few more updates. Over the past 11 months, I have hosted several roundtable discussions with diverse constituent interest groups, including labor unions, nationwide insurance and limited brands, credit unions and local financial service providers that includes a range of banks and insurance companies from Heartland Bank, Huntington Bank, and Grange Insurance, several colleges and universities, Ohio universities and local universities in my Washington and Columbus office. We've also been very proud to have been the host of women's groups and many ethnic and cultural groups, young children, Head Start groups, and nurses, and the list goes on and on. I also had the great distinct pleasure of meeting the president of Somalia. What a wonderful experience. So as you can see, it has been a very busy 11 months serving you in Congress. Since I've been sworn in, my office has responded to more than 22,000 correspondence, including emails, telephone calls, letters, and fax. We have held hundreds of meetings, both here in my district office and in my Washington office. I have introduced 5 bills and co-sponsored 158 pieces of legislation. The House of Representatives has taken 570 roll call votes, and 47 public laws have been enacted in the 113th Congress thus far. If you have any questions about the legislation that I have introduced or any of the other pieces that have been passed or are up for votes, remember, press 0 for assistance and someone will assist you. Serving Ohio's 3rd Congressional District in Congress is an honor and a privilege. I am a proud member of the House Financial Services Committee, which has jurisdiction over many issues that affect Central Ohio. The committee has held hearings on federal banking policies, home ownership, housing finance reform, and insurance matters. If you would like to ask a question about the work on financial services, again, please press 0. But I believe the most disappointing day of my freshman term thus far was September the 30th, 2013, when at midnight on October the 1st, the federal government shut down for the first time since 1996. Because of the shutdown, hundreds of thousands of federal employees were immediately furloughed. Small Business Administration stopped approving applications for small businesses to obtain loans and loan guarantees. National parks and the Smithsonian museums and other federal lands were closed, as you probably will remember. VA call centers and hotlines to assist veterans, they too were affected. The National Institute of Health shut down most of the ongoing research, which certainly, as you will probably remember, affected children with cancer, and they were turned away from clinical trials. The FDA, the Food Drug Administration, was unable to support a majority of food and safety and nutrition and cosmetic activities. For 16 days, Americans had to endure the bare-bones federal government, unable to provide necessary support and resources. We kept our offices open, and I'm proud of that. And in our district, certainly there were effects of the shutdown, and they were effects that almost was felt immediately. But we continued to forge ahead. And there were those in Congress who thought our government could be funded by piecemeal efforts, picking and choosing which agency or federal government should reopen. But I believe that Americans deserve a fully functioning government that will protect, advocate, and assist them in their daily lives. I bring this up because I know many of you have had questions and may still have questions about the shutdown and what happened during those days of the shutdown. Congress had to deal with also raising the federal debt or ceiling, or else the United States would have defaulted on its financial obligations. For the first time in our nation's history, for me and many of my colleagues, such an option was unacceptable. The full faith and credit of the United States is not negotiable. Congress raising the debt ceiling does not grow our deficit, as you know. Instead, it allowed the Department of Treasury to pay the bills for what Congress had already spent. Had Congress not raised the debt ceiling and had our nation defaulted, Americans would have felt the impact immediately. Payments to our soldiers and veterans for their services would have been delayed. In Ohio, I think it's important to note that over 100,000 veterans received disability compensation. It would have been unthinkable for the federal government to fail to pay the benefits they earned from their years of service. Had the debt ceiling not been raised, more than 36 million Social Security recipients would not have received their benefits. In Ohio, over 2 million residents rely on Social Security to make their ends meet. A default would have forced them to choose between paying their rent or maybe buying groceries. Thus, I was pleased to support the bipartisan bill that reopened the government on October the 17th, 2013, and allowed hundreds of thousands of federal employees to return to work. This bipartisan agreement funds the federal government through January the 15th, 2014, and increased the debt ceiling through February the 7th, 2014. So now you see, we still have a lot of work to do. And now it's time for Congress to continue working on a long-term budget for our country. We must stop waiting till the last minute to tackle major issues, which is why I was glad that the House and Senate immediately appointed the budget conferees. That's the people who sit down and confer and decide on the budget recommendation. I am proud to report to you that the budget conferees have been meeting on a regular basis and having important discussions about our nation's long-term fiscal health. Our nation faces too many real challenges for us to have to deal with manufactured crises. In my opinion, the government shutdown and the uncertainty surrounding the debt ceiling were unnecessary and contributed to suffering and hardship for far too many Americans. Unfortunately, an extreme part of the Republican Party sought to shut down the nation's full faith credit and means to repeal or delay implementation of the Affordable Care Act. And we'll hear more about the Affordable Care Act shortly. And while I open to questions on how to improve the Affordable Care Act, I will not stand for the federal government to be held hostage by any unreasonable members of Congress who are seeking to advance their own irrational agendas. That was the low point for our country. But now, more good news. I am very optimistic that bipartisan members, that's Republicans and Democrats, members of the House and Senate, working together to come up with a long-term budget solution for our federal government. I am hopeful that reasonable heads will prevail, and we as elected officials will find the proper balance to ensure that the critical national priorities are funded. Government waste is eliminated, and future generations, like the young child in the audience today, are not left with insurmountable debt. However, we cannot let the budget be balanced on our nation's most at-risk citizens, including senior citizens and veterans and young children. If you have a question about the government shutdown, we will be taking those questions tonight. Press 0 and you will be assisted. I look forward to taking questions about the government. Many of you have called in with questions, so we are looking forward to answering those questions. Now, I would like to turn the telephone over to Kathleen Falk from HHS to speak about the Affordable Care Act and its current enrollment phase. We know the Affordable Care Act is more than just a website, and we all agree, congressional Republicans and Democrats and the President, that the difficulties in assessing healthcare.gov are unacceptable. Kathleen is here to discuss access to enrollment and to help us further understand how the Affordable Care Act will affect you and your family. After her brief presentation, we will have time for Affordable Care Act related questions with Kathleen before we move on to some more general questions. Again, remember to press 0 if you would like to ask a question, and you will be assisted. Kathleen, are you with us?
I am, Congresswoman.
Well, thank you. We're going to allow you to just do very briefly some opening remarks because I believe we might have a lot of questions from people on the line or here with us tonight.
Terrific. And let me start by thanking you, Congresswoman, for your incredible efforts at putting this teletown hall meeting together tonight and all of your efforts to help Ohioans get more affordable health care. Thank you so much.
Thank you.
It's a great honor to be with you tonight on behalf of Secretary Kathleen Sebelius as her regional director. I have personally been in the Columbus area a couple times in the last 6 weeks or so and just been delighted to meet with your constituents there, Congresswoman. But there's about 116,000 in Hamilton County alone that do not have health insurance, and so this outreach that you're doing is just so important.
Thank you.
We're about 6 weeks into a 26-week-long enrollment window to the brand-new health insurance marketplace, and the data is showing that about 6 out of 10 of us who don't have health insurance today may be able to buy coverage for less than $100 a month. Before turning to this important new opportunity, though, let me just remind all of us that the Affordable Care Act is already making a difference in our lives. For example, if you are a mom or dad, like so many of us are, and your children are in their early 20s, you worry about them not having health care. Well, thanks for the Affordable Care Act, our children now can stay on our health insurance policies until they're 26 years old. And that means 97,000 young adults in Ohio have health insurance that they didn't have before the Affordable Care Act. Another one of the benefits of the Affordable Care Act is that those with private insurance who already have insurance now get essential preventive care at no out-of-pocket cost for things like blood pressure and cholesterol screenings, Pap tests and mammograms, flu shots and cancer screenings. All these are so important to helping us stay healthier. But there's more good news to come from the Affordable Care Act. Starting in January 1st, all plans in this new marketplace must cover 10 essential benefits: doctor's visits and hospital stays, preventive care and prescription drugs, substance abuse and mental health services, maternity care and oral and vision care for children. Discrimination based on gender or pre-existing conditions like diabetes or cancer will no longer be allowed. Insurers will no longer be able to cancel your coverage just because you make an honest mistake, nor will they be allowed to put annual limits on your coverage for these essential benefits. All of this because of the Affordable Care Act. Well, as the President has said, the idea is simple. What the marketplace has done is create a competition where there wasn't competition before. And insurers are interested in getting your business, so they've created new health plans with many choices. And when you add the new tax credits and the cost sharing that's available to many, prices come down even further. Now, there are 4 basic ways you can apply for and enroll in coverage: online, over the phone, by submitting a paper application, or by utilizing a regular insurance agent or broker. Now, you can compare these new health insurance plans side by side, and you should start to do so by having handy your Social Security number and your income information. You'll be entering this basic information about yourself and family, and in Ohio, consumers will be able to choose from an average of 46 qualified health plans. The website will say clearly what each plan covers and what each plan costs. You'll be able to see right there if you qualify for tax credits that will lower your cost on your monthly premiums, or if you're eligible for other cost sharing for out-of-pocket costs such as deductibles. When you're on the website, you can do a virtual chat with a live customer service representative if you want to and have any questions. You can also do it the good old-fashioned way and do a downloadable paper application. And your application is physically mailed to an address on the form that will tell you, you will then get a response that will tell you how to complete the enrollment process. Or you can call the toll-free call center and get help 24 hours a day, 7 days a week from a live customer representative who can answer your questions or even walk you through the entire enrollment process if you wish. That number is 1-800-318-2596, with translation services available in 150 languages, as well as a hearing-impaired line. Also, you may go to a, quote, local help button, find local help button, where you can insert your zip code, and up will pop a number of local organizations that can provide you with direct, in-person, one-on-one assistance as well. Either way you enroll, coverage can start as soon as January 1st, but this open enrollment period lasts until March 31st. Now, to date, over 20 million people have visited the website. To meet this overwhelming demand, experts are working around the clock to make improvements to the website. Some of the best and brightest from inside and outside of government have been brought in to help improve the system. They have developed a punch list of fixes, and the website will continue to improve, and so that it is fully functional by the end of the month. But as the President said, the Affordable Care Act is more than a website. It's affordable, quality health insurance available to everyone. The product is good. The health insurance that's being provided is good. As Secretary Kathleen Sebelius says, she won't be satisfied until this door is wide open so that millions of Americans can access this health care they've been waiting for so long to come. Secretary Sebelius herself was recently in Columbus. I know she met with the mayor and the public health commissioners and constituents of yours, Congresswoman, who are eager to shop in this new marketplace. We look forward now to answering questions of your constituents. I'm just very grateful that one of the experts here from CMS, Michaela Monahan, is here to answer the tough questions. You can give me the easy ones. And she, in fact, just got back from helping citizens in Ohio. I think she was in Miles and Akron, and we are eager to be of service to you and your constituents. Thank you.
Thank you so much, Kathleen, for that great introduction. We do have a number of people who are on the line and who have called in. For those of you who are on the line, we're going to start with the affordable care questions. We know we have other questions, so just be patient with us. The first question comes from Evelyn from Columbus. Evelyn's question is, can you explain the impact of the ACA on the uninsured and those who currently have insurance?
Why don't I start here, and then Michaela can jump in, and that is, let me take the second part of the question. For anyone now who has private insurance, and that is by far the majority of Ohioans, if you're on Medicaid, for example, or you have private insurance through your workplace, you can keep your insurance. You do not need to do anything. So what we're talking about tonight under the new Affordable Care Act is for those citizens who do not have insurance right now and will be looking at their options over the next couple of months.
Absolutely, and I would also just reiterate that the health insurance marketplace is a really great new opportunity for individuals who don't have health insurance. It's a new way for them to go look for health insurance options, and one of the pieces of the Affordable Care Act with regards to the marketplace is given individuals access to more affordable health insurance. While they are looking at their application and eligibility, they may qualify for ways in which that health insurance could be more affordable. So that is an impact for individuals who are uninsured. It's a new way for them to access health insurance. And in addition, I just would reiterate what Kathleen mentioned, and I hear some questions and concerns about, for instance, particularly for individuals who have employer coverage that they're happy with, and those who are enrolled in Medicare. If there are Medicare beneficiaries who are listening, we just want to reiterate that you have minimum essential coverage, and you do not have to take any steps with regards to the marketplace as it pertains to your health insurance.
Okay, Evelyn, are you still there?
Yes, I am.
Okay, was that helpful to you?
Yes, but also I would like to ask one more question. Like if you have grandsons and they're not working steady jobs, they're working like temporary jobs, and they only last for so long. And now, with this Affordable Care Act, how would that work for them?
Sure, let me start out with that one. Thank you, Evelyn. So could I ask how old your son is, roughly? Well, she may just be listening now instead of speaking on her phone, so why don't I try to answer that? If he is still a dependent and under the age of 26, he can receive insurance through Evelyn's insurance policy if she has an insurance policy herself. If he is independent and for tax purposes and on his own, and even if he's working not steadily but regularly, he would qualify as a young person under the age of 30 to be able to purchase a minimal insurance package. It's called the catastrophic package, which will at least protect him in the event of a car accident, which we hope would never happen, but when does, is financially so overwhelming. So young people under the age of 30 have a number of alternatives when they go onto the website for purchasing insurance. What the data is showing, about half of those young people will be able to buy insurance for $50 or less a month. And for those whom have a greater financial need, who don't have steady work, they can buy a lesser policy called catastrophic, which is even a smaller amount. Thank you. Do you want to add anything to that?
I just want to commend you for helping bring this information back to your son. And I also would encourage you to use the Find Local Help feature and access an individual or a counselor that might be in your area who could talk to your son through his individual circumstance. It is also possible that in addition to some of the marketplace coverage like the catastrophic coverage, that depending on his circumstance, he may qualify for Medicaid expansion. So there will be hopefully insurance options for him for 2014.
Thank you. Next we have a caller that is Jerry from Columbus.
Yes. Good evening. How are you?
Well, I think Lewis Center. I'm sorry.
Yes, it's Columbus Metro. I have a question in regards to the Obamacare. If it's that good, why doesn't the President and Congress and so many other government workers not have to abide by Obamacare or join into it? And why are they subsidized? Why is Congress subsidized for their health care far beyond what the American public gets?
Well, maybe I should take the first stab at answering that, and thank you, Jerry, for the question. First, let me just say not only members of Congress, but all of our federal employee staff must participate in the affordable care, and it is not subsidized any differently than when I worked in local or state or county government. We do pay our share, and you're not the first person to say this. Evidently, we have not done a good job of educating the people that we do not get free health care. We pay our portion, and we are also mandated or required, not only the staff and federal employees, but the members. For example, in our district office, which, as you know, is here in the 3rd Congressional District, our staff must go into the D.C. plan as everyone else does. So I did want to clarify that about the question that we received from you was, if the AC is so great, why don't members of Congress have to participate? So thank you very much for your question. Next, we have a question that comes from David from Reynoldsburg.
Yes, thank you, Congresswoman. My question was, first, I just have a lot of concerns about the Affordable Care Act and the implementation of it, especially with the problems with the website and all of that. But the one thing that's been worrying me about the plan is that its funding it is based upon a certain amount of people being in the system. And my question is, what happens if there is not enough people put into the system to support it? And what happens if there's a larger percentage of people in the system that have serious medical conditions that would bog down the system? How would that affect things? Because it seems to me that would become a hindrance.
Thank you, sir, for those good questions, and I'm hoping that I respond to them here by this answer, but let me know if I'm not. And that is that two things, kind of a pragmatic answer first. You know, we have seen such an overwhelming response to this incredible, first-time opportunity that began in the beginning of October. To have 20 million people accessing this website, I think shows a level of interest out there for people that we've never had before. And so given that, it suggests that there is going to be, over the next 5 months of the enrollment period, substantial numbers of people taking advantage of this opportunity. And the second part of the question that you asked was, if people don't sign up, what happens then when they're hurt and sick, and who covers that cost? And that's, again, another good question, and I think what we've had in the past, where everyone who does have insurance is paying for the medical cost of those who don't have insurance, because those charges, are passed on to other customers. And in fact, when people can't access health care on a day-to-day basis, they get sicker and then need even more expensive care. So part of the intent and philosophy behind the Affordable Care Act, as I understand it, was to require these kinds of preventive services to help keep us healthier, and that too should reduce overall health care costs that are otherwise so high for our nation.
Thank you. Hopefully that was helpful. Our next question comes from Brenda in Columbus.
Yes, thank you. I was wondering, my husband has insurance, but I don't. And I was wondering, would this be a thing where he would have to change his over where we both could be on the health care, or can it just be me on the health care and we would go by what the income would be for just me only?
Bill, I'm going to ask her to help me here, but I think, ma'am, that we know part of the answer to your question, which is that your husband can stay on his insurance with his employer, and you are able to shop in this new marketplace.
Okay.
I think the answer for the income part of the question is that you list the household income that gets reported to the IRS. So when you file jointly for taxes, you would report that full household income on the application.
Well, see, we don't have income. He's retired.
I think the answer is still the same, but he can keep his insurance if he wants to and continues to like that insurance.
Okay.
Thank you. Next, we're going to go to Michael from Columbus.
Yes, Congresswoman, thank you for having us participate in this. My question was, because of the Affordable Care Act, I was told that my health insurance from me and my wife's employer, our health insurance went up 25% this year. I mean, it was a major increase per month. And, I understand that, everyone has to pay the cost, but what is being done to try to keep the cost for the people that are working and had insurance before from their costs becoming so outrageous that we can't afford it? Thank you.
Thank you, sir, for that question, and I'll try to respond in what I hope are a couple of useful points. One of the provisions in the Affordable Care Act, one of the goals is to try to help reduce overall health care costs for all of us, whether you have insurance now or were uninsured. So, for two examples, one I've already mentioned, which is by requiring these preventive health benefits, we will be healthier and stay healthier and to not have to utilize more expensive services when we do get sick. But another one are requirements for cost efficiencies, such as the following example, and that is that most insurance companies will now have to show that they are spending 80%, at least 80% of their revenue on actual patient care as opposed to profits or something else. These kinds of incentives and requirements in the Affordable Care Act are all intended to help our nation reduce what it spends on health care, given it's such a significant cost in our economy. On an individual basis, one-on-one, family by family, you may wish to shop elsewhere too, given what you have heard from your insurance company for next year, like you normally would, or most of us normally would each year, in reevaluating whether we want to stay with a certain company or change or alter our policy in somewhere. So you may want to look at the options in this new marketplace to see if any one of those might be better for you and your family.
Thank you so much. And let me just say to our audience, good news is we have thousands of people on the line now, and the calls are coming in. We have probably a half dozen more health care questions with the affordable health care, and then we are going to get to the shutdown questions and the Social Security questions. But the next question comes from Carmela from Columbus.
Yes. How does the affordable health care help someone who doesn't have any insurance, since there's supposed to be a penalty if you don't enroll by January? So how does that work for someone with no income coming in?
Good question.
Thank you, ma'am, for asking that question. And there could be a variety of options for you. If you have no income, for example, you may be eligible for Medicaid. The state of Ohio has expanded Medicaid, as was welcomed under the Affordable Care Act, because the federal government pays for at least the several initial years 100% of the funding. So it was a good deal for the state of Ohio, and of course will help hundreds of thousands of people in Ohio get health care. And you may be in that category. And what you can learn whether you are in that category, again, by going to this website, because it will tell you if you are Medicaid eligible based on your financial situation, or it will tell you what plans are available to you, and then what cost sharing would exist based on your finances. And because each person is different, the computer is set up to respect that fact and then provide the options that exist for you. So I think that you have 5 months yet to do, 4.5 months yet to do that kind of shopping. If you want your coverage to start by January 1st, then you need to make a decision and purchase a plan by December 15th. But you have until the end of March to make your choice. There is not a penalty for you unless you don't sign up before March 31st.
Thank you so much. And we have a question that's almost very akin to that question, and it's from Darlene from Columbus. Darlene, she may have helped answer your question, but since you're already on Medicaid, I'll let you ask your question.
Yes. Being that I'm already on Medicaid, should I still check into the Affordable Care Act? Will I get better insurance, or will I still get the same kind as if I'm on Medicaid?
No, you can stay exactly where you are. If you are satisfied with your insurance, you stay exactly where you are. Coincidentally, this is the same time of the year as every year when citizens like the one who's just called, who are in Medicaid, can look at the policy they have, the provider they have, and they can choose to change providers if they want. It's called the open enrollment period. But you do not have to change providers, and that has nothing to do with the Affordable Care Act. It's the normal time every year that the millions of people on Medicare can change their insurance if they choose.
All right.
And thank you, and that was an excellent question, and we have several people who have asked questions something like that. Now we have a question from a small business owner, and that question, he said, would you ask, as a small business owner with 10 employees, how do we work within the Affordable Care Act guidelines to provide health insurance to our employees? Gennaro from Columbus.
Kayla, and I'm going to answer that. So I really want to applaud Gennaro for looking into coverage options for their small business employees. We know that that's really important to small business owners, and I would encourage Gennaro to take advantage of our Small Business Health Options Program, or the SHOP, which is a way in which small business owners can access the health insurance marketplace and look at the variety of ways in which they are able to provide health insurance to their employees. That expands the small business tax credit, which can go towards paying for the cost of the employer contribution for their employees' health plans, It also gives them flexibility to choose how much they're able to provide for their employees' health insurance, and it's a really great resource for small business owners. The shop will be able to be found on healthcare.gov as well. And in addition, the Small Business Administration and the Small Business Majority have been very active in the state of Ohio. And between our agency and those two entities, there is help available to you, as well as you can continue to use your agent or broker.
For example, they have weekly webinars that anyone can listen in and learn about, and those are on their website. So thank you.
No, thank you. Next we have caller Tessie from Columbus, very similar to the Medicaid question. She has a Medicare question. Tessie, are you there?
Yes, I am. I wanted to know what effect, if any, does the Act have upon persons like myself who are on Medicare?
That is an excellent question. The Affordable Care Act did impact Medicare in some, I think, very positive ways for Medicare beneficiaries. So one of the ways in which the ACA impacted Medicare beneficiaries is the closure of the donut hole, or the coverage gap, which you may be familiar with, which was a period of time where seniors would have been responsible for 100% of their drug costs. And for a lot of seniors, that was a very heavy burden. And so the Affordable Care Act is incrementally, over the next several years, going to be closing the donut hole or the coverage gap to provide seniors some support during that time they are paying less out of their own pocket. In addition, the Affordable Care Act really has a focus on prevention, and that carries through for Medicare beneficiaries. So Medicare beneficiaries have access to free preventative services through Medicare, and that can include mammographies, colonoscopies, and in addition, we like to make sure that Medicare beneficiaries are aware that that also comes with an annual wellness exam, which is a free exam that you can go talk to your doctor. It's a conversation about things that may have changed in your health throughout the year, perhaps some close family members, a sibling or a parent or a child, and that might impact your health and could provide you some open doors to access some free testing or other types of disease prevention services. That was a really great question.
Thank you. Next we have Daniel from Canal Winchester. Daniel's question is very similar to the other lady who did not have insurance, and maybe your question has already been answered, Daniel, but you were next in our queue, so I wanted you to at least be able to ask if you feel you have not been answered.
Well, I do have part of the answer, but it was a question. My question has to deal with the cost to a person who has no income, and the person I'm thinking about is 38 years old, and they said they were denied for Medicaid. What would happen in that scenario? How can he get insurance?
I would advise that I don't know if it's a family member or a friend, but that individual should either call our call center or use the local health finder to find someone who can help them personally within the area. My advice would be that the Medicaid expansion group is a newly eligible population for the state of Ohio, and without knowing the particulars, that individual may have been previously not eligible for Medicaid, but could be eligible for Medicaid under this new group, this new expanded group. So the call center and talking to someone in person for local help, working through that individual's personal case, could be able to help provide some guidance on what the health insurance options are.
Thank you so much, and thank you, Daniel, for calling in. Next, we have Del Ray from Columbus. Del Ray's question is a good question, but Del Ray, I think you're going to find out that the age of 40 is not the magical answer unless that person is on Medicaid. But Del Ray, are you there to ask your question?
Yes, Congresswoman, I am. And actually, I kind of have a two-parter. First of all, like I say, I had heard that if you were over 40, you were possibly exempt from the individual mandate. But also, too, I wanted to ask, how does the ACA affect veterans who are receiving care through the VA?
Thank you for that call. And no, there's no exemption for people over 40 from the Affordable Care Act. But veterans are not affected by the Affordable Care Act. You continue to get your veteran benefits and care through the Veterans Administration.
Okay. Thank you.
Sure.
Okay. Thank you again, Delray. Now we have a question from Linda from Pickerington. What can be done to stop insurance companies from canceling plans because they don't meet all of the new standards that are a part of the Affordable Care Act?
Before I answer that one, I just wanted to thank Delray for his service and any of the veterans that are on our call here tonight. Monday is Veterans Day, and I just want to salute you all and thank you.
Absolutely.
Turning to the question of what can you do if your private insurance company has canceled your plan, go to the marketplace and shop. Before the Affordable Care Act, companies could cancel their plans when they chose to do so. And so companies can still cancel plans. And so if you are in that spot, you should look at the marketplace and see if one of these 46 plans in Ohio work for you or your family. You can also go to a regular insurance broker outside of the marketplace, as you normally would to purchase insurance. That's also a fine option. If you do want to take advantage of the tax credits or the cost sharing, though, you need to buy that insurance through the marketplace, but you can do so with the aid of a regular insurance agent and broker.
Thank you for that. Next, we have a caller named Gwen from Columbus. Now, Gwen's question has a lot of parts, so I'm going to read those parts, and then, Gwen, since you've also acknowledged that you are sick, Gwen's question is that she really doesn't understand the bill, and, Gwen, we're hearing that from a lot of people, so that's okay. Does everyone have to sign up? Question one. Is there a penalty? Question one. She doesn't have an insurance and she's sick, so she would like to know her options. And this may be something that we can do one-on-one with Gwen, Kathleen, because we are going to take about 3 more affordable health care questions, and then we're going to move to a few other questions that have been in our queue since the beginning. And then if we have time, we will come back to those questions.
This is Michaela, and I will try to address Gwen's question. So the answer to the first question is that, yes, as a result of the Affordable Care Act, we're trying to get individuals who are uninsured to sign up for health insurance. And so I really want to thank Gwen for looking into her health insurance options. It's obviously important to her. So we encourage her to sign up for health insurance, as everyone else who may be on the call who is uninsured or maybe knows a family member or friend who is uninsured. There is a penalty for most individuals who continue throughout the year of 2014 and have chosen not to sign up for some form of health insurance coverage. And as far as your illness and what your options are, the good news is that as a result of the Affordable Care Act, health insurance company is not going to be discriminating against you depending on what your illness is. It's not part of the marketplace application or eligibility, and health insurance companies will not be able to discriminate against you. So I would encourage Gwen to call the 1-800 number, or if she so is comfortable, going online and looking at healthcare.gov, or using healthcare.gov or the call center to locate someone for local assistance in her area. And again, because it's a very personal decision that's based on your circumstances and your income and your household, individuals will be able to help you through what your options are and what the best way for you to get health insurance would be.
Thanks a lot for answering that, and thanks, Gwen. Next, we're going to go to Pam from Columbus, and Pam is retiring in February. Pam, are you there?
Yes, I am. And thank you, Congresswoman, for having this forum.
Thank you.
Very interesting. Yes, I will be retiring in February with less than, the usual 30 years. So my retirement insurance premium will be high for me with my new lower income. Could I forego my retirement pension and go with the affordable health care?
Well, I don't know if you are in an insurance program that you can continue as a retiree.
I can.
So you would want to check that and see if that is a plan that is affordable and works for you.
Well, and I know it's going to be, very high for just me. My husband will no longer have insurance, so I'm sure he can go to the health care.
Yeah, so there is a provision in the Affordable Care Act that if your health insurance, the cost of your health insurance is roughly more than 9.5% of what your income would be, then it's not considered affordable. The IRS has some really great frequently asked questions specifically about that particular piece. But if you find using their guidelines that your retiree insurance plan is not considered to be affordable, then you would be eligible to shop on the marketplace and have access to the advanced premium tax credits or the cost-sharing reductions that might make that insurance more affordable for you.
Okay, and one other question. Is there any training you can get to help the people in the community learn about this? I would like to do something like that.
That is a great question.
You're going to think we set this up, but honest listeners, we didn't. There are a number of fabulous organizations in the Columbus area. The City of Columbus itself, Southeast Health Care Center, UCAN, the Columbus Neighborhood Center. There is a wonderful list of fabulous organizations that have staff on hand that have been trained to help individuals one-on-one that can be very specific to your own personal and family needs. And you can find that list through the website where you click in, find local help. In fact, just today, coincidentally, Secretary Sebelius awarded a very large grant to the Columbus Neighborhood Health Center to allow them to get more capacity to help educate people on the Affordable Care Act and to deliver more health services. So you have great leaders and organizations in the Columbus area that you can all access.
All righty. I'll check that out. Thank you.
Kathleen, and thank you, Pam. And from our listening audience, I've just been informed that also in our district we have the John Maloney Center, and they also will help you there with training and have people on board there. So great question. Again, press 0 to ask a question. Now we have two people who came in at the same time on the line with the same question. So we're going to take the question for Ruth because it came in, and Ruth from Columbus. And Jackie, if you are listening, we're going to let the one answer because it's the identical question. Ruth, are you there?
Yes. My question then is for those people who may not have access to the Internet and the online program that is being talked about, how then can we get the name or names of a center in the Columbus area along with a phone number or more than a phone number of centers that are available for people to contact the facility by phone to ask questions for the kind of help they need in getting themselves set up or to get some other person to help them to get set up.
I would call the toll-free number that I'm going to give you right now, and you can ask them either those questions at that toll-free number, or you can ask them on the toll-free number what are the names and phone numbers of local organizations in your zip code area? Sure. Either way, that toll-free number is 1-800.
1-800.
318.
318. Yes.
2596.
2596. And
this
is strictly
24 hours a day, 7 days a week.
Oh, terrific.
150 languages, including a hearing impaired line.
Okay.
Thank you so much for the number, Kathleen and Ruth. Thank you so much for the question. Jackie, since you called in, I want to make sure that you did get that 800 number. Jackie, are you there?
Yes.
Okay, and that number again is 1-800-318-2596. We also have 3 other people who asked that question.
Well, that wasn't my question.
Oh, I'm sorry. You didn't have access to the internet, and how?
Well, I don't, but I've called the 800 number already, and they would not agree to give me any help unless I gave them my Social Security number and my birth date and all this other personal information that I didn't feel was necessary in order to advise me on what marketplaces, how many companies are available for me to shop.
Well, I'm sorry.
So I've talked to the 800 number, but they won't give me any information unless I provide them with all my personal Social Security number and so forth.
I'm sorry you had a bad experience, and so let me try to be helpful here to you,
Thank you.
is there are basically 2 kinds of calls that go into the call center. One is the kind that Ruth was asking about. If you have general questions, you want to find out who's a group in your community that you can go visit with that will help you walk through the enrollment process. For that, the call center doesn't need a lot of information from you. But if you are seriously looking at what the specific rates would be for any one of those given plans available, the reason why they ask for that personal information is that it will trigger and make available to you whether there are tax credits available or cost savings. So they're actually trying to be helpful because no 2 people have the same financial history. Of course not. And so the laws that allow for these tax credits and these cost sharing options are all dependent on what your exact income is. And so that is why more complicated level of questions. I hope that's helpful.
Why would they need my social for that? I can tell them
Let me tell you why. One of the things you're telling them is what your income was last year. And if you're signing up for insurance and expect to get this tax credit, the computer verifies whether that income is what you did make last year. So that's why. I mean, it's to protect taxpayers.
Well, I'm on Social Security, so they know what I made.
But I think what she's saying is, and I certainly understand that because I'm one of those people who would be a little skeptical giving information out. But because you're on Social Security, what Kathleen is sharing, and this is not just for this is for any insurance, they have to verify. That could be me calling in and saying that, or a neighbor or somebody who works with you. So they have to have verifiable information from you. So it's a good thing, Jackie, but you have to weigh through that, and I certainly understand that many people are skeptical, but it is a good thing in my opinion. And thank you, because you're probably not the only person with that question out there. But thank you very much. We're going to go to Shirley from Columbus. Shirley, are you there?
Yes. I would like to know, I have a grandson, and he has a felony, and I'm speaking for him and all the rest of them that have felonies.
Sure.
How do they get on this health plan? If it's mandatory.
And I guess what the question, to put it in a question, are you asking, can people with a felony get health insurance?
Can they?
Yes.
Oh, okay.
And this is a good thing. And Shirley, I thank you for saying not only for your family member, but for all the other folks out here, because so often when it comes to things like insurance or voter registration, people put it out there that if you have a felony, you can't vote, you can't get insurance. So I personally thank you for asking that question, and we were able to hopefully clarify that. Okay, we have Rob from Columbus on the line. And we're going to take two more health care, and then we have 11-year-old, and I'm afraid he's going to have to be in bed soon, so we're going to go to this 11-year-old's question. Rob, are you there?
Yes, I am.
Go ahead, Rob.
It's a pleasure to talk with you, Congresswoman, and also those that are involved. My question is, I'm disabled and I'm on Social Security with Medicare, and I have a spin down with Medicaid. But this past year, I was hit with a deductible. And for my eye exam, I had to pay $147, which luckily I had. But my deductible for my Part D drug benefit was like $438. Now, for some reason, I don't know where that came from or why, but I was asking also, in this new plan, is there any way those of us that are on Medicare and Medicaid, is there a provision for dental as well as vision? Because that is not completely at all covered on Medicare or Medicaid.
That's a really great question, and when I'm in the community, it is an area of concern that I hear a lot from Medicare beneficiaries about their coverage. Unfortunately, the ACA does not change Medicare or the Medicaid program in terms of their vision or dental benefits. So there is not an impact as a result of the ACA on expanding your vision or dental benefits with Medicare.
Okay, well, so as it stands, we should keep what we have and just try to get an addition to that. Is that what I'm hearing?
Yeah, I think that's an option that you can absolutely consider. With regards to your Medicare and your Medicaid coverage, the answer is that your coverage meets the wonderful thresholds of care and the great quality of care that we expect from Medicare and Medicaid. And the marketplace would not necessarily be cost effective for you because you are eligible for Medicare and Medicaid and enrolled in the programs. You would not be eligible for the ways in which those marketplace plans become a little bit more affordable. So no, I would encourage you to stay with Medicare and Medicaid, and that you could definitely look into supplemental vision or dental if you so chose to do that.
All right, then. Well, thank you for your answers.
Okay, thank you.
Thank you for your question.
We have one question after this, and then Caleb, if you're listening, get ready. We have Lorraine from Columbus.
Yes, thank you so much for conducting this teleconference. It's very informative. Mine is not really a question. Mine is just a broad statement. I'm very concerned about the Medicaid expansion and the fact that it is now before the Supreme Court of Ohio. Does not make me feel any better, unfortunately, about it being approved. And I guess what I'm saying is I hope that everyone on this line and will stay tuned in to what is going on and continue to do anything that they can to advocate for the expansion of Medicaid. Because without that, we're going to have many, many people in Ohio that simply will not be able to benefit from the Affordable Care Act. So that was my statement more than a question. But there was a question just asked previously that I think is important. If somebody is on a spend down, Medicaid spend down, that will, if I understood correctly, the answer, that Medicaid spend down, and they're currently on Medicaid naturally, that will not be changed. The Affordable Care Act will have no effect on Medicaid provisions that are now existing. Is that what I should have understood?
I think that's what we're both saying.
I think so.
Okay. Thank you again, and let's hope for Medicaid expansion.
There we go. Okay, Manola from Columbus, and this is our last ACA call.
Yes. Hello, I'm calling in regards to my copay for my Medicare, and I haven't been able to get on Medicaid, and I have all this, my health is not that well, and I have a lot of high copays, a lot of doctor's appointments, and it's just been hard. I have to move out of my house, and my kids moved me down to Columbus here, and I'm in a apartment complex. And it's just so hard to try to pay my rent and to pay my copay for my Medicare. So I'm wondering, why was it that they denied me for Medicaid? They say I make too much money, my income is too much, which is only $11.87.
Sure. I can't necessarily answer the specific question about your denial of Medicaid because it's a very personal application that probably would be better discussed with someone at the state Medicaid office. And I'm not sure if you're enrolled in original Medicare, but if you're referring to your copays having to do with perhaps a Medicare Advantage plan, I would make sure that you know that this is the time of year it's open enrollment for Medicare, and that you can call 1-800-MEDICARE and reevaluate your current coverage, and it's you can talk to someone to find out if there is a plan that would be a little bit cheaper for you. Maybe the copays are a little bit more affordable. Maybe there would be something that could be changed to help you with some of those out-of-pocket costs. And so you would call 1-800-MEDICARE, and you could talk to someone about your specific circumstance.
Okay. Thank you so much.
Hopefully that was helpful to you. Okay, now we're going to 11-years old Caleb. Are you there, Caleb?
Hello?
Hi.
I'm here.
Would you like to ask your question, Caleb? Everybody's waiting. We're very excited.
Well, okay. So I know that the government has recently risen up from its shutdown, but how can we prevent another shutdown?
Okay. Caleb, I think that's a very good question, and you're right. We had an awful experience, as I highlighted in my opening remarks. Let me just say, because I think we should always try to build hope, especially for our young future leaders like you. I think we all learned and had a very painful experience. I think one of the things we're trying to do is use the time we have now with the conferees, with everyone working on it, so we can be ahead of the game. So when the end of the year and January and February gets here and we get to the deadlines, we will have a plan in action. And that means bipartisanship. That means both sides of the aisle have to work together, and I think we are starting to do that. And that we will get to the point where hopefully we could come up with a long-range solution, and it won't be as short-term as we're doing now. What school do you go to, Caleb?
Well, I go to Worthington Christian Elementary. Middle school.
All right. Well, I want to thank you very much. You were our only young person at this time to call in, and we really appreciate you being interested in government. And I'm going to give you my office number. That number is 614-220-0003. And I want you to call in, and my staff's going to be waiting to talk to you, and we're going to see if we can't get you into our congressional office. Would you like that?
Yes, please.
Okay. Thank you again, Caleb. Before we go to the next question, let me again thank Kathleen Falk for being on the call for us and helping to facilitate all of those Affordable Care Act questions. And let me say to our audience out there, thank you for all of those affordable health care questions. Many folks called in with repeated or duplicative calls, and it was very helpful to all of us. And again, Kathleen, thank you to you and to your team for being such great assistance to us.
Thank you so much for putting together this important teleconference call. It was very good of you and for all your leadership.
Thank you. We have a few more calls. We're going to go back up, and let's see if Arlene is still on the line. And Arlene, first, are you there, Arlene?
Is it Earlene?
Earlene, I'm sorry, Earlene.
Yeah.
Let me say you have to be the most patient person because you were our first caller, but unfortunately we needed to take the affordable care calls first. So go ahead, Earlene, with your call.
Yes, I was just wondering, is they going to cut Social Security and Medicare?
Let me say that is probably one of the most popular questions that I have been receiving. And the answer I can give you is absolutely not if I can help it. Part of what, and I have been joined by other colleagues because we are not supportive of cutting Social Security or Medicare. We are very hopeful that the conferees will understand the value to the people who receive it, and so we are working hard. It has been something that has been discussed, so I need to say that in all fairness, but I can tell you I am not supportive of cutting Social Security.
Okay, thank you.
No, thank you so much. Now we are going to go to Pearline of Winchester.
Okay. Hi. Thank you
Hi,
for
Pearline.
taking my call.
Thank you.
Sure. My call is in reference to veterans issues. In 1985, I entered basic training for the U.S. Army in Alabama, served my time, and I'm out. 10 years ago, I filed a claim, disability claim, and what has happened is the records from where I served basic training, the base closed, there were no records available. Those records are necessary in order to file the claim, but because there are no records, I can't file the claim. So my question is this. And I'm not the only veteran. I've talked to so many veterans where this has happened to. Will there be established some type of just maybe a minimum disability amount allotted to us because the records were lost on through no fault of our own, if, of course, we can prove that we were there on the base, which we can.
Sure.
We just don't have access to the records. Number two, where do we go to try and find records that supposedly no one can find?
And let me answer this way, Pearline, and say thank you for this, and again, thank you for your service. And you are right. During this shutdown, we received a large number of calls from veterans. And one of the things in working with my staff, they reminded me if we got calls like this to share is that there has been a lot of dialogue about setting a minimum standard as that VA backlog grows. But unfortunately, as you know, we had the shutdown and the progress on the claims that have been taking place, they got backlogged. But we can help you get access to your records, and we have someone in our office. If you can take down our 614-220-0003 number and ask for Veronica.
Veronica. Okay.
And Veronica is our certified case management director, and she works extensively with veterans, and she is very familiar with this. And let me again say thank you for bringing this up, because we have several people who were asking the same question.
Wonderful. Thank you for caring.
No, thank you. Next we have Faye from Reynoldsburg. And I think that's another student. Hi, Faye.
This is Faye, and I'm a student at Ohio Dominican, and we are having a petition drive in regards to a complete repeal for the Higher Education Act that was established in 1998, and it has an aid elimination provision on there in regards to minor drug convictions. And because of these convictions, individuals, especially those within the African American community and Latino community, are not eligible for financial aid, which can lead to a higher education, which can also lead to better employment, which can take and break the cycle of incarceration. So I just wanted to know, what is your stand on this, and if we could get your support in regards to a complete repeal.
Let me just tell you that I am supportive of what you're doing, and there are efforts to repeal that in the Higher Education Act reauthorization, and that is long overdue. But it is something that I can support. I have very strong feelings about this. It's the same thing if a person has had some type of difficulty, they were incarcerated, they pay their time, they get out and they get a license, let's say, to be a barber, and they go to school. Now we're saying if you've had a felony, you can't have any license. Okay. So this falls in that same category to me, and I have been a long-time person who would like to repeal those things, because for whatever those mistakes, you were convicted, you now, let's say, have gone through rehab or whatever, we should not be holding you hostage to educating yourself nor employment. So thank you for standing up and doing that for other students, not only at Ohio Dominican, but for our other academic institutions.
And thank you for all that you're doing in our district.
No, thank you. Okay, next we have Bill from Columbus. Bill, are you still there?
Yes, I am still here.
Well, thank you, Bill.
Social Security. I've retired, but that was before you called.
Thank you, Bill, for having patience.
My question relates to Social Security. The Social Security money reserves will run out in about 20 years at the present rate of benefits and so forth. And I was wondering, at that point, because at that point the benefits will drop to about 77% of what's there. So folks, after that 20 years, are going to see a dramatic reduction. What are your plans to keep this thing afloat for perhaps the next 50 years?
Well, let me just say I join you about being very concerned about what's going to happen in the next decade and that after with Social Service reserves, because these are earned benefits, certainly, as you know, and intended to protect those who have paid into the system. I think one of the things, Bill, that we're probably going to find out as we look at the upcoming reforms, it's going to take all of us. That's like the lady that called in earlier wanting to know if we were going to be able to keep Social Security from being cut or repealed. This is something that we're looking at now to have an answer for the future, and I think I have to be very honest and say right now everything is on the table, but there are a number of us who are fighting to preserve Social Security.
Well, thank you, and someday you can retire.
There you go. Thanks,
so
Bill. Okay, next we have Marvin from Columbus. Marvin, are you still there?
Yes, ma'am. Yes, ma'am. First, I'd like to thank you, Congresswoman Beatty, for your service and all of the things that you and your family have done for us over the many years, because you all have just been tremendous, the Beatty family. But I have 2 points of question. One is I have a deafblind grandson who attends Columbus City schools, and he has a certified deafblind educator here with him who has come over from Scotland. And we're trying to get her visa renewed so that she can remain here with the ability to teach him. There's no one in the Columbus district who has any experience or education in educating deafblind students, and so she's the only person that we know in this district or throughout the state of Ohio who has that level of education and training. And so it's so very important to us that she be allowed to stay here on her visa so that she can continue all the things that she's doing. But one of the issues that we've run into is that she does not live in your district, but we do, and my grandson does. And for our sake, we're asking if you would consider sending a letter in our behalf to the U.S. Department of Immigration indicating some of the concerns about her not receiving a continuation of her visa and asking for the support and continuation of her visa after December of this year, and how we would go about getting that done or what we would need to provide to you and your office to do that. That's my first question. And then second is that we're very much interested in working with the Columbus City School District with the IDEA program, which which is it provides support for special needs children in the district. But what we're dealing with is, in order to get someone with education and training to educate deafblind children, they have what has been created as a certification process. And we found a paraprofessional who's working with my grandson on a day-to-day basis within the school district, who's willing to take the courses and become educated and trained to be a certified intervener. But the district does not have funds to provide monies for the person to be educated and trained. Now, I actually don't understand how that could be the case, but that is what we're dealing with. And so we're asking if there's any way through the IDEA program or through any other type program that funds could be identified to provide education for a day-to-day educator through the district to be educated in the specific area for educating deafblind children. The last is that I'm seeing that there's not a great deal of transparency between what occurs with the district and with the providers of the services to special needs children. Most of the special needs children that are in the district are receiving paraprofessional services, but those people are being primarily directed by the district as to what to do, what to say, how to do it, and how not to do it. And so they're not working with open minds as to what is the best possible thing that can be done to educate this child. And I'm wondering what can be done to facilitate a more transparent and a more open dialogue for the parents and the schools and the district to find the best ways to educate the children that they're working with.
Okay, Marvin, let me start by saying, one, thank you for your call, and let me try to take this in pieces. The first part is I was going to answer to your question about your grandson who is deaf and blind, was to refer you to the Individuals with Disability Education Act program, and it sounds like you've really done your homework on that, because certainly, as you know, and for other callers who have an interest in this, they help local school districts in the state to fulfill the needs of children with those special needs. So for more information on that, I'm going to refer you to my district office, because we have a case manager here who deals with that and can go in more detail. The next thing I want to clarify for our callers, that when you're saying the lack of transparency and et cetera in the district, I assume you're talking about the school districts versus
yes.
the Congressional District.
Yeah, not your district.
And I and not just for me, but for all of the different congressional individuals.
Yes.
So you have a combined issue with many moving parts. So as you talk about the tutor, again, it's not as important whether she lives in my district or not. We will be as helpful as we can. But what I'd like you to do is to call the office for that, because it would take up too much time and there would be too much confidential and personal information that probably our case managers are going to ask you. And then we'll get to your last part, if and how we can help with assistance with some type of letter. So I would like for you to contact the office at 614-220-0003. And again, you can ask for Veronica.
Okay.
Okay.
Thank you so much, Congresswoman Beatty.
You're quite welcome.
Bye-bye. Bye-bye.
Hey, do we have Julian from Juan from Columbus on the line?
Yes. Good evening, Congress Joyce Beatty. I have two questions. My first question is, will there be a accountability for the 16-day shutdown that the government has established? One of the things I was really concerned about how it affects many of our communities and how it stonewall many of people trying to move forward that were just coming out of depression and things in that nature, things in that way. Now, my second question is that even though that they threw away $24 billion away, because that's the money that could have, kept the government open and continue to have positive programs moving out here. The thing that hurts me the most, Congress, Joyce Beatty, is that I see in certain communities where there's hardly no jobs, and I see kids is making bad choices to sell drugs and get caught with $10 worth of bag of weed or $20 worth crack or things in that nature, and they getting sentenced left and right. I go to the courts and I sit down and I see these kind of things is happening, and it breaks my heart to see that. But the part that really affects me the most is that I watched these Tea Parties throw away $24 billion, and I'm just wondering, will there be any kind of indictments that will be sent to that kind of Tea Party establishment? Because someone has to hold these people for accountability. And the reason why I say that is that if here it is, if our kids can be sentenced for 5 to 10, 15 years, I'm not saying that it's okay to do this. It's wrong. Let me say that clearly. Right. It's wrong. But for them to make a move like that, a lot of times people don't understand that they don't have the tools to move out of that kind of situation and things in that nature. And I'm just really concerned about getting people involved and looking at this issue on a political level as to where everybody can participate and get involved and help certain crisis in our poor communities.
Juan, let me just say thank you, because I think in part of your question you hit on something that was very important. And how can we get this message out? How can we hold people accountable? And how can we do that? One is at the polls and through the ballot boxes, whether it is Tea Party, whether it is Democrat or Republican. But in this case, I think you're right on track. And I can just just tell you personally, every day that I was there, and every opportunity I had, I tried through print and electronic media to go to the floor and to advocate for us opening government because the American people deserved more. And because there are so many, whether it's veterans or our young people or those who are incarcerated, getting out and needing jobs, $24 billion in 16 days. Wow. Someone should be held accountable. Some will say that there were opportunities, but those were piecemeal opportunities. And part of my answer to you, many of us did not support the piecemeal because then you were making us make a choice between a veteran's disability or a cancer patient. And I like to give the example of parents having 7 children and you allowing 3 of them to be fed and then watching the other 4 children starve. So many of us stood strong because we wanted a whole government, and we wanted the government opened up so we could pay all of our bills and have the responsibilities that we made a commitment to as members of Congress. So you're on the right track. I can tell you that tonight, with the thousands of people who've been on this call, here's a good way that we're sending that message out. Your question, so let me end it by saying, yes, we should hold members of Congress accountable, and yes, the shutdown did hurt our poorest and those who are most at risk. And so, Juan, thank you so much for your call.
Thank you so much. You have a wonderful night.
Let me say now that we are really excited that we had planned to do this until 8 o'clock. We're going to take one last caller, and that's Beverly from Columbus. And then we're going to close out and say thank you to the thousands of people who have been on this call, and to also remind you again that we're going to have an in-person Town Hall, State of the 3rd Congressional District in early 2014. And for updates, you can sign up for my newsletter at Beatty, that's BEATTY .house.gov. Beverly, are you there?
Yes, I am. Thank you for taking my call.
Thank you.
And I would like to know, are we going to get a raise in our Social Security this year in 2014?
Well, let me just say that the answer, I believe, is yes, that we are slated to get I think it's a 1.5% for nearly 63 million people, and it's tied to the inflation rate. So that
I have one more.
We're hoping for.
I have one more question. Did they take money out of our Social Security for the Affordable Health Care Act?
To my knowledge, the answer to that is no.
Oh, okay.
No, that they did not do that.
Oh, okay. Thank you very much. It was very interesting tonight.
And thank you so much for staying on the call. Let me just say that we have taken our last question. And if you were unable to ask your question, we want you to be able to do that. So you may leave a voice message with your question, and I will follow up with you. Again, thank you tonight for being with us for our second Teletown Hall meeting. And again, visit my website at www.beatty.house.gov. Thank you for your time and participation. It was wonderful to speak with you, and we wish everyone a wonderful holiday season.